In this video, we'll go through causes of pain in the legs. Common causes include arthritis, sciatica, cellulitis, and deep vein thrombosis. Less common causes include ischemia, ruptured Baker's cyst, and malignancy. First, let's talk about arthritis of the knee. In arthritis, pain is dull and aching in character and lasts for months to even years. It commonly affects the vertebral column and knee joints. Pain in the legs gets worse with weight bearing. In arthritis, the inflammation of the knee joint results in loss of joint space over time, as seen here. Septic arthritis involves the infection of a joint resulting in a red-hot, swollen joint. Other symptoms include fever, malaise, and shivering, as seen with any infection. Diagnosis can be made even by an X-ray, which reveals joint erosions, or joint aspiration and fluid analysis. Next cause of leg pain is sciatica, in which the pain radiates from the lower back to lower limbs. The pain can be sudden or gradual in onset, and occurs most commonly due to lumbar disc herniation, particularly the nerve roots L4, L5, and S1. In clinical settings, patient is asked to perform a straight leg raise which elicits pain due to limitation of hip flexion in lumbar disc herniation. A CT or MRI scan is done to visualize the herniation, as seen here. Recovery usually involves symptomatic treatment and early mobilization. Cellulitis in lower limbs also causes pain. Cellulitis is a streptococcal or staphylococcal skin infection, which leads to formation of an abscess and inflammation. The inflammation then causes localized leg pain. Pain is dull and aching in character and sudden in onset. Other symptoms include edema, erythema, blistering, and fever. Diagnosis can be made by a blood CP, which shows raised white cell count and can be confirmed by a biopsy of the affected area. Deep vein thrombosis is another common cause of leg pain. A thrombus forms around one-way valves present in veins, which eventually block venous blood flow. Pain is dull and aching in character and gradual in onset. Other signs include leg swelling, pitting edema, and mild fever. Diagnosis can be made clinically according to Wells criteria, which involves checking D-dimer levels in serum in case of low probability. If raised, this is followed by an ultrasound of the leg. High probability of DVT warrants an ultrasound of the leg straight away. Now we'll go through rare causes of leg pain, first of which is limb ischemia. It can be divided into acute limb ischemia and chronic limb ischemia. Acute limb ischemia is a surgical emergency, and revascularization must be done within 6 hours to save the limb. It usually occurs due to an embolus that originates from the heart and gets lodged in peripheral arteries in the leg. The signs and symptoms can be remembered as 6 P's: pain, perishing cold, paralysis, pulselessness, paresthesia, and pallor. In chronic limb ischemia, pain is cramping and initially intermittent, but eventually occurs even at rest. The pain is relieved by hanging the affected leg over the edge of the bed. It is typically caused by atherosclerosis, causing narrowing of the lumen. Chronic limb ischemia can also lead to ulceration and gangrene. Diagnosis is made by a lower than normal ankle brachial pressure index. Color Doppler ultrasound and peripheral angiography of the leg is done to locate the affected artery. Another rare cause of leg pain is ruptured Baker's cyst. A Baker's cyst is a fluid-filled cavity that forms in the popliteal fossa. Baker's cyst can be formed due to inflammation of knee joint, as seen in arthritis, or a knee injury, as seen in anterior cruciate ligament tear. Symptoms include sudden onset knee pain and calf swelling. Baker's cyst can be diagnosed by an ultrasound of the knee. which visualizes soft tissue. Last on our list is malignancy. Pain is the most common symptom of bone cancer, such as osteosarcoma, which usually affects the knee. Symptoms include aching pain, localized swelling, and fever. Fractures also become more likely. Diagnosis can be confirmed by a biopsy, and a CT or MRI scan can be done to determine the extent of tumor. Unsurprisingly, leg pain is treated by analgesics, and the WHO analgesic ladder is often used to aid in choosing the right analgesic. So for mild pain, non-opioids such as paracetamol or NSAIDs are used. For moderate pain, weak opioid is combined with a non-opioid. Weak opioids include codeine or tramadol. For severe pain, a strong opioid is combined with a non-opioid. Strong opioids include morphine, oxycodone, and fentanyl patches. For acute pain, we go down the ladder, choosing the most potent analgesic first. For chronic pain, as felt in cancer, we go up the ladder, starting with the least potent analgesic. Finally, pain adjuvants can also be used along with analgesics, an example being the intra-articular hydrocortisone injections. With that, we conclude today's topic of painful leg, its causes along with their investigation, and treatment. I hope this has been helpful. See you next time on sqadia.com.